Well, this week was supposed to be the end of compounding for Eli Lilly's weight loss drug, Zepbound, now that the drug is no longer in shortage. But things aren't going exactly as planned. Angelica Peebles joins us now with more. Angelica.
That's right, Melissa. If you look online, it doesn't look like a whole lot has changed. Popular sites like Amble, Mochi Health, and Henry Meds are all still selling tirzepatide. Now, there have been some that have taken it down, but we are still seeing it. Now, taking a step back, small compounding pharmacies were supposed to stop making tirzepatide earlier this month, and the large ones had until this week. All the large facilities need to stop making tirzepatide, full stop. The smaller ones need to stop making essential copies of the drugs. But what if you make a different dose? Or what if you combine it with another drugs? Some pharmacies and providers are banking on personalization to keep going.
It can be anything. It can be different dosing schedules. It can be, some patients prefer to go up in dosage much more slowly. Some patients like to mix a number of other medications into their compounded formulations, depending on the side effects that they're having. Some patients have side effects with any additives and brand name formulations. There's compounding really opens up the door for so much personalization.
So we'll have to see how that strategy shakes out legally, and it's really up to the FDA to police this market now, not Lilly. Though we have seen Lilly be very aggressive, it'll be interesting to see if they take any moves here, but now all eyes are on the FDA. Melissa?
Do you think that any headway could be made through all the lawsuits? I mean, Novo has, 105 lawsuits or something like that against various compounders for various different reasons, but Lilly feasibly has also got lawsuits against compounders to make them stop.
Yeah, and you've seen them be very active here in trying to go after the compounders. But, people I talk to say that so far that strategy hasn't panned out. And actually, in one case, the judge threw it out because they were saying that Lilly was trying to enforce the Food, Drug, and Cosmetic Act, which only the FDA can do. So it'll be interesting to see if that strategy is actually something they can pursue going forward. But I have no doubt that you will see Lilly try to do at least something here because they have so much on the line.
I need some remedial work here. So what is really going on? So you get these things, and then they got to be injected. I'm so clueless on this, which proves I'm not on any of these things. But what are we talking about here? You buy like some crappy thrown together thing that's like sort of like Zepbound. Do you inject it into your leg or stomach or something? How does it? Fill me in, will you? You think everybody knows what you're talking about? I rarely know what people are talking about. What?
Yeah, Joe. So basically what's happening is that, for the past few years, you've been able to go online and get a compounded version of tirzepatide. Remember, that's the active ingredient in Lilly's Zepbound and Mounjaro. And compounding facilities, they can get the API, which is the active pharmaceutical ingredient, and make their own versions. And that's allowed when these drugs are in shortage. And then the FDA last fall said that the drug is no longer in shortage, and so that compounding in mass needs to stop. And so that's why these large facilities have had to stop. But then it gets a little bit more complicated with the smaller pharmacies that just have to stop making an essential copy. And so already, if you go online, you can see that some pharmacies are combining it with a vitamin B12 or B6. And lawyers will tell you that's probably still an essential copy, but people are doing it. And so those are some of the things, or even the different doses, like you heard the CEO of Mochi Health saying that, their versions are personalized, and therefore that's why they think that they can keep going. And so that's really what you're seeing here, is that people are making their own versions of tirzepatide, and they are made in pharmacies. I don't, want to make it sound like these are necessarily being made like in a basement somewhere. That's not to say that's not happening, right, but these are being made in regulated pharmacies. But, it'll be interesting to see what happens from here.
Weird. I mean, you're not going to make like Neupogen or some unbelievable, the state-of-the-art biotechnology, that are, made in very sophisticated ways. This must be just throwing a couple of things. But it sounds to me, though, Angelica, they brought this on themselves by making it okay if it's in short supply. That's totally arbitrary. Okay, now it's well supplied by, that's almost a commercial reason to say you can't do it anymore. Not that there's safety issues. And if I was able to get it, when it was in short supply, and now they say, oh, no, you can't do it anymore because the drug company that owns it has to be able to make money, so you can't do it now. That seems like a pretty lame reason to tell people they can't do it.
There are some very angry compounders out there, that is for sure. Talk to them, and there are a lot of unhappy people and also a lot of unhappy patients who've been able to get this drug for much cheaper than they can get from Eli Lilly, also from Novo Nordisk. That deadline is coming up by the end of May. People have to stop making compounded semaglutide, which is the same thing as Wegovy. Yeah. And so you're going to see a lot of pain here for patients. And, some people will say that's on the fault of the companies. Like, these drugs should not be so expensive that you're putting people in this impossible position. But then, the companies will say, we did this, we should recoup those profits.
You needed to